Emma.
Morning, everybody. I've been reading about the reports that have been done and the investigations, and they seem to be showing that the inspection outcomes are getting much worse, with 60% of areas inspected in 2018 having to have a written statement of action. So just to start with, I wondered whether you thought we currently had a functioning special educational needs and disability system.
Okay, if you'd like me to begin. I think one of the things that we have to look at the very beginning is what is it actually that the reforms were intending to achieve. And initially it was because SEN support was complicated, the issues were being picked up too late, too much duplication, focus on input rather than output, and a cliff edge of support for children and adult services, and parents finding the system adversarial. I think obviously at this stage, what our inspection findings find is that there's still a disjointed and inconsistent picture.
Thank you. Jill?
Yeah, I think it's important to say that although our inspection outcomes at the moment are highlighting weaknesses and which result in areas getting a written statement of action, we've also been to some areas where we have seen the reforms introduced really well and children and young people getting a really good deal. And I think the inspection work that we're doing, this framework, it's groundbreaking because it's the first time that we've had a joint focus with CQC on the experiences that children and young people with SEND have in the local community, and we're highlighting through our reports what's working well, what needs to improve further. I think for us, perhaps the disappointing part is that as we're going to new local areas, that the learning from other local areas doesn't seem to be picked up quickly enough, effectively enough. And there is perhaps a sense of some local areas maybe waiting for us to go in as the inspectorate to sort of help them work out how to make it better. So, but I think we mustn't forget that it has had a very positive impact on some children.
With respect, in 2016 you had 25% of local areas having to have a written statement of action, in 2017 51%, and in 2018 60%. So the impression given from the inspections that you're doing is that it's not currently working well.
I think that is related to the introduction of the new legislation when we were initially, it was about giving local areas time to implement the new way of working and the educational health care plans. And as we've gone further down the line, 3 years into these reforms, obviously the expectation is that the local area wouldn't be on the way to introducing the reforms, they would be in place. So, Jonathan, you know the detail better than I.
Hear from the
so I think I would echo that. I mean, clearly, in the early days of the inspections, what we were looking at was the written intent of local areas in terms of what they said they were intending to do. The difference now with the later inspections is actually being able to assess what is actually happening and what has changed on the ground. And as Jill has said, while we have found some very good practice, I think what we're able to do with these inspections is highlight some of the areas where local authorities and their partners, particularly the NHS, are struggling. That both enables us to work to help with what some of those interventions might be, but I think to also register our concern about what the pace of change is and what difference this is making to parents, young people on the ground, but also I think to frontline practitioners who are always at the sharp end of managing these cases and situations when children and young people's needs are not being properly met by the system.
No, I'd echo that. I think the issue very much is our expectations in relation to what we see as increased. We're expecting a more robust response 3 years down the line than we originally expected. I think as well that our findings generally have reflected the way in which local agencies have worked together and the way in which the system has worked together locally. And I think some of that requires quite significant change and takes time to change. So I think it's been another issue, I think.
Thanks very much. So what do you think would be, if we accept that at the moment it's not working in the vast majority of areas, what do you think would be more realistic and fair way to say that it should be working? How could you mentioned about sharing best practice, you've mentioned about expectations, and we've heard evidence before that the Act did raise expectations. So what more could be done? Because it seems a bit like you're going in there saying that some of these areas need a written statement of action, and then it seems to be a bit hazy as to what happens next and how are they supported to improve next. There doesn't seem to be that clarity there. So what should be done? What should the system do?
Okay, so if I can just speak about what happens when an area has been given a written statement of action, is that the local area then has 70 days following publication of report to produce an action plan on how they're going to address the weaknesses found. The action plan is then declared fit for purpose by Ofsted and CQC, and then what happens next then is that advisors from the Department for Education and NHS England go in and support and challenge the local area.
Okay, well, with the evidence we've had back here, says there seems to be concerns about the accountability process being hidden and that local people, including parents and professionals, become shut out. And that people here have said that in Suffolk, the SEN leaders have been summoning to a meeting with the DfE and NHS England, and Suffolk parents are asked not to attend the meeting. Is that...
I think that's something for the DfE and NHS England, because
so you're not part
we don't
of that process?
we don't have a part of that process at all.
So after you've sort of gone in and checked the written statement of action, then you withdraw from that?
That's like, if I can speak about Suffolk, so what happened in November 2018 following the Secretary of State's request in July 2018 was for us to revisit those local areas that had been issued with a written statement of action. That was the situation that happened in Suffolk. We went into Suffolk to look at how effective or whether the local area had made sufficient progress in addressing the weaknesses found in the local area at the time of the initial inspection. We went into Suffolk and found that it hadn't made sufficient progress, and it was following on from that, which is that meeting that you're referring to.
I think when this inspection framework was set up, it was set up as a one-off inspection framework to give a picture of the experiences of children and young people and their families, and how the new reforms were being implemented. And it was seen as a one-off inspection framework. There was no follow-up to it. So the areas aren't graded, and the written statement of action was seen as something that would be implemented and lead to improvement. And I think perhaps one of the difficulties with a framework of this nature is that if it's seen as a one-off, then you have your inspection and then you breathe a sigh of relief if you're on the receiving end of it, potentially. You know, I think that can happen. And so the follow-up to a written statement of action came as a bit of a surprise to local areas. And I think there has been a flurry of panic now that we've introduced the follow-up, because, of course, it was unexpected. And I suppose the question for us, as in terms of writing frameworks and trying to drive improvement for young people and their families, is a one-off framework a good idea in itself? Or should it be part of a rolling programme where there's always the thought that actually there'll be some check on this further down the line? And I think part of the results that we're seeing, and potentially, though I have no evidence really to say this, is potentially the reason why we might have been seeing more written statements of action is because it hasn't got the same weight as an inspection cycle where you're going back over a period of time.
And I think the other thing that we might want to add, as people have commented on, is I think really beginning to understand what needs to happen underneath. So I think the early statements of action that we would say that we did sign off and approve were often quite transactional. They were about the mechanics of how systems and processes operated. Actually, what we've come to understand, and we understand that right across the partnership system around health, education and social care, is it is about how leaders work together, it's about how leaders prioritise, it's about how people make difficult decisions, and we think really importantly how they involve children, parents, young people and frontline staff in these processes. And therefore what we would now accept as a written statement of action, I think is very different in terms of understanding the transformational nature of what needs to happen, not just how quickly are the forms being processed and how quickly are the assessments being done. That's why then the programme of follow-up inspections becomes so important. And I think for us some of those issues like organisational churn, the length of time people are staying in post, some of those continuity issues then become really important to being able to embed these changes in local partnership communities for the benefit of children and young people.
Yeah, and I think, just to add to that as well, I think the added experience we've had since the beginning of the programme has been very much also working quite closely with NHS England. So we've shared platforms with them. We've joined them in regional events to raise the profile of the SEND programme, of the inspection programme. We've shared our inspection findings with NHSE colleagues. So there's been quite a programme of work underneath that to provide support to local areas from a health perspective.
Thank you.